Welcome to Module 5, Acute versus Chronic Wounds, a foundational piece in your wound care learning journey. At first glance, many wounds appear similar, but their healing behavior, the risks they carry, and the clinical care they require can be vastly different. Why does this matter? Because a wound that should be healing, yet isn't, may be quietly heading toward complications like infection, necrosis, or chronicity. As nurses, our job is not only to treat, but to detect, differentiate, and act early. In this module, we'll build your confidence in identifying acute versus chronic wounds, understanding why some heal while others don't, and taking the right actions to get your patients on the best path to recovery. By the end of this module, you'll be able to define and differentiate between acute and chronic wounds based on their duration, clinical features, and healing behavior. Describe the biological processes and pathological disruptions that impact each type of wound. Identify common causes, from trauma and surgery to diabetes and pressure, and the complications they can lead to. Use this knowledge to guide your assessments, select the most appropriate treatments, and escalate care when needed. Remember, this module is not just about classification, it's about using wound behavior to anticipate problems, prevent deterioration, and personalize your care planning. Let's begin with a basic but crucial concept. Not all wounds heal the same way. An acute wound, like a surgical incision or a clean cut, usually follows a predictable timeline. Bleeding stops, inflammation resolves, tissue regrows, and closure occurs. But sometimes that process gets stuck. Instead of healing, the wound lingers, infected, inflamed, or stalled in one phase for weeks or months. That's a chronic wound. As a nurse, recognizing this early is critical. It affects how often you assess, what kind of dressing you apply, whether you escalate to a wound care specialist, and how you educate the patient about long-term risks. Think of it this way. An acute wound is like a sprinter. It wants to heal fast. A chronic wound is more like a traffic jam. It's delayed, blocked, and going nowhere without intervention. So, how do you tell the difference? Let's find out. Let's define the two main categories: acute and chronic wounds. Acute wounds follow a well-orchestrated biological symphony. They move smoothly through 4 healing phases: bleeding, inflammation, proliferation, and remodeling. In contrast, chronic wounds become stuck, usually in the inflammatory phase. This prolonged inflammation creates an environment where healing can't proceed. You'll often see these wounds linger for more than 4 to 6 weeks, with little progress despite standard care. Understanding this distinction is critical. It determines your urgency, referral pathway, and choice of treatment strategy. Now, let's take a closer look at acute wounds. These typically result from surgical incisions, traumatic cuts or lacerations, burns, abrasions, puncture wounds, or skin tears. They're often recent, clean, and straightforward. What you'll see? Well-defined edges. Minimal to moderate exudate little or no necrotic tissue. The healing process is timely and predictable, resolving within days to a few weeks, assuming proper care. Your nursing focus here is on supportive care. Maintain a moist wound environment to promote epithelial growth, prevent infection with proper hygiene and aseptic technique. Remove sutures or staples on time. Provide education on wound care and activity restrictions. Acute wounds are often low risk, but they still require your clinical attention to prevent complications. On the other hand, chronic wounds are often more complex, persistent, and problematic. These include diabetic foot ulcers, venous and arterial ulcers, pressure injuries, particularly stage 3 or 4, ulcers related to radiation or malignancy. What makes them chronic? They don't heal as expected, even with standard care. They often show slow or necrotic tissue that needs debridement, irregular, undermined, or rolled wound edges, signs of biofilm, odor, and persistent exudate. Ongoing pain, especially with dressing changes. These wounds may persist for months to years and frequently require interdisciplinary care: podiatrists, vascular surgeons, endocrinologists, and wound care specialists. As a nurse, you'll manage complex dressing protocols, perform detailed assessments, monitor for infection, and provide long-term education and emotional support to patients and caregivers. Let's talk science, because understanding the biological differences between acute and chronic wounds helps you make smarter clinical decisions. In an acute wound, the body coordinates an efficient healing response. Neutrophils clear pathogens quickly. Macrophages transition smoothly into tissue repair roles. Angiogenesis forms new blood vessels rapidly. Collagen synthesis is organized and purposeful. But in chronic wounds, this system breaks down. Inflammation is prolonged and ineffective, often due to persistent infection, ischemia, or systemic disease. Macrophage function is impaired, leading to poor cytokine signaling. Angiogenesis is weak, reducing blood flow and oxygen delivery. Collagen production is disorganized, leading to fragile, non-healing tissue. This isn't just theoretical. These disruptions are what lead to hypergranulation tissue, biofilm formation, delayed closure, and a higher risk of scarring and re-injury. When you understand these mechanisms, you can better predict complications, select the appropriate dressing or therapy, and advocate for advanced interventions when needed. Even the most routine acute wound can become chronic if we miss the warning signs. Here are key barriers that disrupt the natural healing process: infection and biofilm. The presence of bacteria, especially in biofilm form, triggers prolonged inflammation and shields pathogens from immune defense and antibiotics. Poor glycemic control in diabetic patients, high blood sugar impairs neutrophil function, delays collagen synthesis, and weakens immune response, leading to delayed healing. Ischemia due to arterial disease or unrelieved pressure. Inadequate perfusion deprives tissue of oxygen and nutrients. Pressure over bony prominences or vascular compromise can stall healing completely. Malnutrition. Without enough protein, zinc, vitamin C, or calories, the body lacks the building blocks to repair tissue. Wound healing literally starves. Repeated trauma or dressing removal. Constant dressing changes or mechanical disruption reopens healing tissue, preventing progress. Immobility or poor offloading. Particularly in pressure injury patients, failure to reposition or relieve pressure causes further damage and delays. Nurses are on the front line. Your vigilance and timely action can stop an acute wound from becoming a chronic, long-term problem. Look for these risks. Intervene early. The wound story is told in its presentation. Let's compare how acute and chronic wounds appear during assessment. Acute wounds often have a known, recent cause, surgery, trauma, or skin tear, and begin healing within a few days to weeks. Pain is often localized and subsides with time. Exudate is moderate and usually clear or serous. Edges are clean and approximated. Tissue appears healthy and granulating. Chronic wounds, on the other hand, have a longer history. Persisting more than 4 to 6 weeks, they may worsen over time. Look for persistent or increasing pain, purulent, foul-smelling exudate, rolled or undermined edges, slough, necrosis, or non-viable tissue. Infection signs like warmth, redness, swelling, or odor. Minimal healing progress, despite standard treatment. These distinctions are essential for care planning, referral decisions, and documentation. Knowing what to look for and what it means empowers you to act effectively. Let's put knowledge into practice. Your wound care approach must reflect the type of wound you're dealing with. For acute wounds, clean using non-cytotoxic solutions like normal saline. Maintain a moist wound environment with appropriate dressings, hydrocolloids, foams, or alginates. Prevent trauma, minimize dressing changes unless necessary. Schedule timely suture or staple removal. Reinforce patient education on hygiene, activity modification, and early signs of infection. for chronic wounds. Take a deeper look at systemic issues, diabetes, vascular insufficiency, malnutrition. Collaborate with the broader team, wound care nurses, podiatrists, vascular surgeons, endocrinologists. Consider advanced therapies, NPWT, negative pressure wound therapy, compression therapy, enzymatic debridement, or biological dressings. Educate the patient and family on long-term management, recurrence prevention, and self-care. To conclude, the difference between acute and chronic wounds isn't just academic, it's a matter of outcomes, early recognition, accurate classification, timely action. These are the hallmarks of great wound care, and they start with you. Nurses are uniquely positioned to identify when healing is on track, or when it's not. Use your knowledge to escalate care, remove barriers, and restore health. Thank you for your commitment to evidence-based, compassionate wound care.